important this election really is. The reason why it's so important, Bobby, is because we're going through a turning point, especially here in LA County with reform, that we need medical service in our penal system. And as you've touched upon today, how challenging it's going to be. Without this man getting into office, folks, it's going to get worse. And so, Bobby, what I'd like you to do in a very short way is show them how effective you're going to be with not only reforming the health, but also affecting the penal code system, because almost 50% of the people who are in our penal system are recidivists just because they have mental conditions that are not really being addressed. They're just being processed for money.
That's a good question. I think if I could summarize it, the question is, why does Los Angeles County Jail have, you said 50%, I've heard numbers around 30%, why does it have a very large population of mentally ill people in it? And is it a good idea for mentally ill people to be incarcerated? That's the question, right? And the answer, I think, to that is no, it's not a good idea for mentally ill people to be in jail. They should be treated in community mental health systems for at least two reasons. Number one, outcomes are better. When they go in professional mental health people, they're more likely to not reoffend and not go back into the system. That's the compassionate, humane way to do it. The second reason is it's much cheaper. It's extremely expensive to jail people. Extremely expensive. The proposal now is to spend $2.1 billion of your money to build a new jail. Now, it's true that they do need a new jail, but whether that jail should be so big that it also jails all the mentally ill and substance abuse and alcohol people is a significant policy question that you're voting on. Because I have said publicly in the 20 or some odd debates that we had in the primaries that I'm against that. I'm for community mental health care treatment. I'm not for jailing people. But at the first discussion of this issue, it's called diversion. The people call it diversion. Before the board about a month and a half ago, and it was the most extensive. Supervisor Yaroslavsky, who I'm trying to succeed, who's a very smart fellow, said it was the most extensive discussion of diversion in his 20-plus years on the board, 6 weeks ago. So Supervisor Ridley Thomas brought that motion up. So it does show you that getting mental health care issues into the debate is hard. He's been on that board 20 years, and he said that was the best discussion he had ever heard 6 weeks ago, and it was a discussion of about an hour. So all of us advocates who are interested in those issues really need to work hard in your own networks to make people know that they can vote now for someone who feels strongly that I would try to change the idea from building the jail for the... The other thing that's good about diverting folks is that you get beds for bad guys. Now a lot of bad guys are discharged because they don't have beds for them. They don't serve their full sentences. And prosecutors feel very ineffective because these bad guys go back out and reoffend in significant ways. So if you put mentally ill people through a mental health care system and the people who have substance abuse issues through substance abuse facilities, we do that, in Santa Monica. You arrest someone for public drunkenness, instead of jailing them, we take them to an AA facility. It works much better and it's much cheaper. Thank you for that question. Yes, ma'am.
In a couple of sentences, could you give us your philosophy